When our minister, Reverend Anne Marie, emailed me about hosting this event, it was a fast and easy, yes, of course. As a public school teacher, I understand the importance of our unions. Teachers and nurses need to stick together. You all do so much good in the world. When my father was in the hospital last year, I was reminded again how nurses make the world go round. You are all saints. But, as with teachers, it's too easy for us to be taken advantage of because we care. We care so much. I could go on and on, but I am also here to listen and learn. So let me welcome Jessica Hunston, a community leader from Highland Park and a member of the coalition who will be facilitating today. And also Carol Tenzie from Robert Wood Johnson, who has been a nurse there for more than 25 years. Welcome, and thank you so much.
Thank you, Lexi, and thank you to this whole congregation for welcoming our coalition and the community here. My name is Jessica Henson, as Lexi said. I'm a Highland Park resident and also an at-large member of our steering committee, which is of this new coalition. So I'll just talk quickly about our coalition, and Carol and I will go back and forth, and then Carol's really going to give us some very important information. So our RWJ Nurses United Community Coalition is a group of rank and file union members, organizations, and community members who are working collaboratively with and in support of nurses across the state to win appropriate and enforceable nurse-to-patient ratios, or what we call safe staffing. Just a quick note that if you haven't signed in, please do so using the QR code or on one of our paper sign-ins around the room. As a community member, I am so aware that the working conditions of the nurses here and the nurses throughout the state and really the nation their working conditions impact our patient care conditions. In the next hour, you will hear from nurses and community members about the serious public health crisis we are facing in our hospitals that leaves both medical workers and patients in unsafe working and patient care conditions.
We won't just talk about the public health issue of safe staffing. We'll also talk about how corporate greed and political power are intertwined to keep working people down. After our speakers, you'll have a chance to respond to the information you hear and to ask your questions. Our hope is in building a coalition and grassroots power with enough people to make enough noise that we can't be ignored. We will invite you to join us in making that noise and taking action.
And before we hear from our speakers today, we want to give out a big shout out to the Unitarian Universalist congregation for hosting us. So we are hoping to have, this is our first town hall. So we hope to have these town halls all over New Jersey, and specifically in communities where we know RWJ Barnabas has hospitals. They're a whole network of hospitals. So this is our first, and we're really appreciative that you're here today. So I'm going to turn it over to Carol.
I think it's day 79 of our unfair labor practice strike, for which they removed our health care benefits after 1 month. And our only fight is to put enforceable, common sense, safe staffing ratios into our contract. We were unaware at the beginning of the strike the magnitude of the beast we are fighting and what lengths they would go to in their attempt to break our union. More than $80 million on scabs, untold amounts of money on extra security, a negative media barrage, removing our healthcare and winging an injunction to severely limit our picketing. That's just the beginning. We had problems pre-COVID, but post has proven to be even worse. It seems that money is no object between all these costs and the multi-million-dollar salaries of the CEO and executives, unless you're talking about reinvesting to provide more nurses to care for the very sick people that go to our hospital. Despite being a facility that prides itself on evidence-based practice, which means letting scientific research dictate how we deliver care, they refuse to acknowledge that research shows that safe staffing does indeed save lives. It also helps prevent nurse burnout, and it also shows that the nurses and community are indeed committed to putting patients over profits. But that is not what is happening here. It isn't even just a shortage of nurses. We don't have enough support staff, meaning that we don't have enough nursing assistants, we don't have enough unit clerks to assist, including watching patients who are more likely to get hurt. We have patient monitors. So that's someone that's actually going to sit with a patient if they're going to harm themselves, and we have a shortage of that as well. We've learned that corporate greed and corrupt politics are alive and well in New Jersey, that decisions and appointments to important positions are not being made to benefit the very community that they pledge to serve, but to secure connections and push a very narrow, self-serving agenda. We've seen a tremendous outpouring of support from the community, but very little real support from elected officials, and nothing at all from the highest ranking state senators or our governor. While they're busy stacking the deck and securing favors, we're seeing the connections between Rutgers politics, Robert Wood Johnson in a much different light. One question, the appointment of Mark Madigan as CEO of Robert Wood Johnson and to the Board of Governors at Rutgers, we should question that. We should question the reason that Phil Murphy's appointment of Mark Madigan to that Board of Governors and his refusal to play any type of meaningful leadership role in the strike of 1,700 healthcare workers, union laborers. And most certainly we should question Phil Murphy's Chief of Staff, George Helmy, who is now becoming the Executive Vice President of Robert Wood Johnson. In the press release, they declared that this new job role, he will oversee all interactions with federal, state, and local governments. He will be key senior strategic advisor on policy matters as well as the health system's relationships with its key external stakeholders. By key external stakeholders, I only wish they meant the community. Nurses think patients are the key stakeholders. The hospital has been trying to push this one part of the contract that we are refusing to accept. It is called core deficit. The easiest way to break that down is to say that staffing is supposed to be, let's say I come to work and my staffing is supposed to be 10 nurses for that shift. When I get there, it's only 8. That is when they would say, okay, you're below your core deficit, we'll send you a nurse. And every nurse on that unit will get $20 extra an hour for that shift. But you're still working short-staffed. Now, if there's a call-out, which nurses do get sick now and again, if you were to call out sick, not only do you get 0 replacement nurses, nobody gets the extra the bonus either. So it's a loophole that they're trying to build into the contract to make it unenforceable so that they will never have to appropriately staff our units. And that's what we're fighting against. At this point, after 79 days, we keep hearing that there's very little movement. It's lots of negotiation. But there's really nothing to take back off the table. There's really nothing to negotiate with. We want the safe staffing. We haven't asked for anything else that's crazy. I think the other big thing we asked for was 36 hours to get full-time benefits for that, which is standard in New Jersey hospitals, but we don't have that. The other thing that is mind-boggling about this university hospital is they have committees that are a waste of everybody's time. Unit-based practice councils, which are supposed to identify issues for each practice area and be communally addressed by the staff nurses in order to come to solutions. This never happens. Year after year, we are ignored and problems never solved. A generous family once donated a respite room after the COVID phenomenon. They donated a respite room for a place for nurses to relax and rejuvenate. It's the cruelest joke because who has time to go respite anywhere? And most nurses don't even know we have that. I'm sure it's being used by executives. Do nurses burn out? What does this mean? Nurses understand what this means. It means feelings of dread when you're driving to work. Difficulty sleeping the night before you have a shift. Difficulty sleeping because you're dreading that you're not going to have enough staff for when you are at work. And stressing the very minute you get your assignment, wow, maybe we do have enough nurses for the shift. Except a unit clerk and a nursing assistant have both called out. So now, what does that mean for your day? You get the correct amount of nurses, but it means in addition to your already very stressful workload, you must absorb the duties that these very important people perform. The show must go on. Suck it up, get to work. Hopefully the train doesn't go off the rails, but if there is an emergency, it's traumatic. You feel responsible, an incredible, overwhelming amount of responsibility for that. If only you had that extra person, that extra pair of hands in a frantic situation. This leaves you with tremendous guilt feelings, which magnify every shift that happens over 25 years. When you don't have a situation that is ever getting better, the dread builds. It's a phenomenon that's been scientifically studied called third victim, because you do become a victim just by virtue of the work we do, and it's real. It can compound over the life of your career, and it is painful. While this not-for-profit hospital is busy making billions in profits, the very important quality of care is being cast aside as staff is asked to do so much more with so much less. Amidst gaslighting and outright cruel treatment, the employees are the heart of and soul of Robert Wood Johnson. We're being left to fight this fight. We are so grateful to have this amazing outpouring of love and support from our community, and together we will achieve what we know is the right outcome: safe staffing for all.
So my name is Erica. I'm one of the nurses at Robert Wood. I work in CVICU, which is the cardiovascular intensive care unit. So we do heart transplants, open heart cabbages, and all other surgeries. So I'm going to talk about the lack of staffing, which is one of the reasons why nurses burn out. So what does the research show? So a lot of the research have demonstrated that if you add an additional patient to the average nurse workload, mortality rate goes up. So in these studies, the most recent that I could find have demonstrated a 12%, a 16% increase. The first study, it looked at 52,000 patients across 116 hospitals in the United States. It looked at the effects of nursing staff levels and the correlation with patient outcomes with sepsis. So those that don't know what sepsis is, it's basically a dangerous infection, just to put it in simple terms. If it's not addressed in a timely manner, patients can die. There's a mortality rate of 30 to 40%. So it is necessary that we find that patients who have sepsis shock are addressed quickly. And also the study did find, and I don't have it here, but they showed that 7% of those patients were more likely to pass away after 60 days. And also 7% of those patients, after they get well and they get discharged, they get readmitted. And the reason why they get readmitted is because of the lack of staff. We don't have time to properly educate the patients to look out for any signs. And that is also why we burn out, because then we feel like we failed the patients. The next study has showed 30-day mortality rate increases at 16%. This was a study done in 87 hospitals in Illinois, and they looked at med-surg nurses. So med-surg is just a regular floor that a lot of the patients end up going, the ones that don't have to go to ICUs. And 16% of mortality rate, that's pretty high. And then the other study is just basically summarizing up. The mortality rates go up. If you actually have good nurse-to-patient ratios, then you decrease readmissions, you decrease length of stay, you decrease nurse burnout. While also doing a lot of the research and look at different articles, there was an article that I came across, the first one. It was in a study back in 2004. There they did also the nurse-to-patient ratios. There they found 7%. But now we're seeing studies from 2021, the percentage is actually going up. When are hospitals going to actually start looking at this percentage of the evidence base and address that it is necessary for nurses to have these ratios? They're taking away our nurses, so we're having less resource and less time to really properly assess our patients. So right now, their situation. So RWJ Barnabas is the largest private employer in New Jersey. It employs 37,000 people. Their CEOs make millions despite tax breaks. The hospitals in this system are considered non-profit hospitals. I'm not sure if anyone here has had the time to look at the document that was released by the Health, Education, and Labor Pension Committee that is run by Bernie Sanders, but they actually break down everything that these hospitals are doing. And it's not just here in New Jersey, it's all throughout the nation. So in the chart, I'm not sure if you guys can see, but it looks at all the different health systems in the nation. It looks at the revenue, how much they're actually putting in towards charity care, and how much their CEOs are making. I highlighted Robert Wood, Barnabas Health. So in 2021, it made $5 billion in revenue. Their main CEO at that time made $17 million. That is not also adding the different CEOs of each individual hospital. And you can see here that of all the money that they made, only 1.6% was given to charity care. This is for low-income patients that can't afford their bills. How's that even possible? Why is this happening? And it's not just here, it's nationwide. So I did research and I wanted to make sure that if there were actually requirements for non-profit hospitals. And there actually are. According to the Affordable Care Act, there's supposed to be free and significantly reduced rates for low-income patients, easily accessible financial assistance programs, which, if you go on the websites, it is hard to find anywhere that will tell you that they have an option for financial assistance. And also I found that each state varies of how much the hospitals are supposed to give to charity care, but what I came across is the minimum, the ideal minimum should be 5%. I also went into the Centers of Medicare and Medicaid Services, and I have 3 different graphs. So the first one is looking at the nonprofit total margins. So we see that the hospitals are actually, their profits are going up. Yes, there are certain years that goes down and up, just like the economy. But if we look from 2011, and I couldn't find the latest one, but the latest for 2022, it has increased. But from that, we have noticed that the hospitals actually have contributed less to charity care, even though their profits have increased. The other thing that I found very interesting is that if you look at nonprofit hospitals, which get like I said, the tax breaks, and for-profit hospitals that don't have tax breaks, for-profit hospitals actually contribute more towards charity care than actual nonprofit hospitals. So in this map, it's just looking at all the different hospitals. There's 12 hospitals within the RWJ Barnabas system. And what I found interesting that the major hospitals in that system are in high poverty percentage towns. So like New Brunswick, Jersey City, Newark. They're way above the national poverty percentage. Yeah, we're only giving 1.6% to charity care. And because of that, I think that not only us nurses should be mad of what is going on, the community. Because not only does it affect us and our patients, but it also affects the rest of the community. Why are these CEOs making more money and not putting it towards back the community? And I will pass it on to Erin just to go more into the situation and explain more. Thank you.
Hi everyone, my name's Erin. I'm also an ICU nurse at Robert Wood, New Brunswick. So pretty much I want to talk about why we are forming this coalition, what we can actually try and accomplish from it, what are we trying to do here. So there's actually 141,000 active nurses in the state of New Jersey, but we don't communicate with each other, we don't all align ourselves with the same goal. But we know that safe staffing is something that actually does affect everyone. The 9 million citizens of New Jersey, residents, are all affected by this. which is also why we've partnered with community groups to try and accomplish this mission. So what we can do is actually try and bring the fight that we have with our hospital through our union and actually try and unite nurses across the entire state of New Jersey and the communities that they serve to actually try and pass a bill, legislation, and get better conditions for everyone in the state. Because we have power in numbers. As Erica was saying, the hospital system is very powerful, they're very wealthy, they have a lot of influence, they have a lot of political influence. But what they don't have is a lot of people. It's a very small group that is making all of these decisions and running everything. And we can overpower them just through the sheer volume of people that are actually affected by this. It's a very simple, common sense, ask that we have here for safe staffing. Which is why the hospital has been so aggressive about trying to shut the message down. Because anyone that hears about safe staffing and hears about how impactful a safe patient-to-nurse ratio is immediately on board. It's common sense. There's no reason that anybody would look at that and say, oh, this doesn't sound like a good idea. We want less nurses. It just doesn't make any sense for anybody. So the thing about Robert Wood New Brunswick is they do have 12 hospitals in the system, but New Brunswick is their flagship hospital. And a lot of the other hospitals are told, when they try to negotiate their contracts or they try to advocate for better conditions for themselves and their patients, this administration says to them, well, they don't even have that stuff in New Brunswick. Why should we give it to you? Their patients are so much sicker. They have to work so much harder, and you're asking for better stuff than they get. Well, the thing is we have to actually fight to raise the bar in New Brunswick to set the ceiling for everyone else. So our fight actually does affect all of the nurses in the system, and our system also is competitive with Atlantic Health and other healthcare systems in Jersey. So whatever we're able to accomplish through our strike is going to have very widespread ripple effects, and honestly it's probably less of a ripple and more of a wave. The CFO, John Dahl, days before we went on strike actually spoke in an interview and said that if they were to provide the concessions that we're asking for as far as safe staffing goes, that they would be forced to give those to all the other nurses, all the other hospitals in the system, and they're concerned about how that's actually going to cut into their bottom line. So what is it actually that we're trying to accomplish? Like Carol talked about, there's a lot of loopholes that they're trying to write into our contract to actually get us, or to actually make it non-enforceable. So what exactly do we want? We want safe staffing at every hospital in New Jersey as a long-term goal. We want nurse-to-patient ratios that actually make sense for the patients. It doesn't make sense to just guess or just to try and make do with, what we can. We have evidence that states, based on how sick a patient is, how many patients that are, how sick a patient is, how many patients a nurse is able to handle. We have evidence that actually supports this. There's no other decisions that are made in healthcare that are just based off of, the vibe or, whatever, we can scrounge together. We don't give a patient a medication just because that's all we have on hand. We actually work to make sure that things are done because there's scientific evidence and backing to what we're doing. If you're not a healthcare professional, the TV shows and movies make it look like the doctors and nurses are just pulling ideas off of the top of their head and, improvising a lot. And, sure that we do some improvising, but everything that we do, every decision we make is informed and backed by evidence. And for the hospital to have policies in place that are backed by evidence, at every single step of the healthcare chain of a patient being admitted to discharge, except for staff ratios, it's a big oversight. And it's not really an oversight because it's intentional. You know, they're doing it because it hurts their bottom line. So if you look at the slide, there's actually proposed federal nurse-to-patient ratios by the National Nurses United. So this is actually an evidence-based ratio based on acuity, which is pretty much what we're asking for at our hospital. Pretty much saying that if a patient is, you know, very sick, they need continuous monitoring, if they need, you know, a higher level of care, it's not safe for them, and it's not safe for the nurse to have too many patients that are at that level. And it goes all the way up the chain into the operating room. And I think that's like a very simple way for anyone who doesn't work at the bedside to kind of visualize. A nurse can't have 2 patients undergoing surgery at the same time. You know, that kind of thinking, that rationale extends even outside of a procedure. You know, I work in the ICU. We have patients who are on ventilators, they're on life support medications. Overlooking something, or, you know, not being able to be with your patient, you know, within even a minute time can be a life or death situation. And the more patients you add on, the harder it is to actually balance that workload, the harder it is to keep track of all of the alarms you're hearing. It's one less nurse that's able to assist on the floor and help out because they have too many patients to take care of on their own. It burdens the rest of the team. That logic extends all the way down through, you know, the acuity, from the most sick patient to the least sick patient in the hospital. Everyone deserves to have care. You know, you come into the hospital, there's so much waiting to get things done. Procedures are delayed. There's, you know, pain medications that aren't given on time. All of these metrics that the hospital measures and prides themselves in would actually be better, you know, if staffing ratios were enforceable. But they're looking not at the big picture here. You know, they only care about what's going to make them the most money in the shortest amount of time. And for them, that's actually, you know, having an incentive to keep us short-staffed. So when we're asking for enforceable staffing ratios, we need them to have a financial penalty for having short staffing, because right now there is an incentive for them to keep the hospital short-staffed. They need to be punished for it so that they lose that incentive, because they won't do it if there's no financial reason for them to do that. So I'm going to pass it off to Isaac, and he will speak about you know, the actual plan of how we can, you know, get things moving and get it done.
Hi everyone, my name is Isaac Jimenez. I'm part of the coalition. I'm a member of the Democratic Socialists of America, so we're going to talk a little bit about the politics of how to get this done in the short term and in the long term. As Aaron mentioned, there's a lot at stake here, not just for the nurses, but for our public health as a community. That's why we think that this fight needs to broaden to include the community with nurses. So as we see on this graph here, what we're doing right now is part of the process that we're going to need to do across the state of New Jersey to create dialogue between healthcare workers and community members, organizations, and to build rank and file networks in the RWJ system, to build community solidarity units that can be points of contact with all of the hospitals in the system. And we're cool with sharing this plan, just sharing it in the open for RWJ management as well. We think the transparency of this plan, the openness is what keeps it democratic and keeps it accountable to the communities that RWJ has hospitals in. So what we did before today was knocked on doors, made a lot of calls, canvases and phone banks to activate both the members, community members and nurses in RWJ facilities, bringing them to town halls like this one, and then organizing, right, educating, and then putting pressure not just on the hospital, but on state legislators. That's because there's one other part of this whole entire issue that we haven't addressed yet, and that's that there is a bill for safe staffing in the state legislature. These town hall meetings that we're at, we're gonna have time, I'm gonna go as quick as I can because I do want to get time to public comment, right? They're gonna focus on safe staffing, hospital priorities, public health as written by the public, right? Not these boards and CEOs telling us what public health is supposed to look like, but you all. So I'm gonna get back to that. But on the long term, on the safe staffing legislation, there's been legislation in the NJ legislature for 20 years that's been passed 20 years, 20 times to the next session to pass safe staffing ratios. This legislation, now in its current iteration, S304, co-sponsored by Linda Greenstein, establishes safe staffing standards for all registered professional nurses. With those ratios, mandates the use of an acuity and staffing system to adjust staffing levels above the minimum standards, looks at the federal standards and gets us towards that, and is enforceable, most importantly. It's not a guideline. There isn't a loophole. It's something that we can win in legislation if we don't win it through the union contract. And so these are the ratios. We've seen some of these already before. It's really important that you have one nurse, one patient in an operating room. So here in Somerville, these are our legislators. Currently in LD 23, which is Somerville, Raritan, Manville, Bridgewater, Bound Brook. If you live in these communities, you should know this. These are your current legislators. We don't know where they stand on safe staffing. So our job here today is to remember this slide, or take a picture if you'd like, and ask these legislators. They're all on the ballot this November. So this is the state senator, Steinhardt, assembly member, 2 assembly members. If you live a little bit of south, and these are the challengers in LD 23 in the same towns in this town. These are the Democrats running for those seats. We don't know where they stand either, so if you know them, let us know. And if you live a little south of here in LD 16, we know there's a competitive race. Andrew Zwicker is a co-sponsor of safe staffing. We don't know where Assembly Roy Freeman is. We do know that Sadaf Jaffer is also agreed to co-sponsor, but she's actually exiting after this lame duck session after this election. So that makes the strategy to pass this really urgent. And the challengers for LD 16, if you live in, I believe, Hillsborough, these are the Republicans running. We should know where they stand as well. So if you know any of these faces, let us know. Or maybe you know right now, we'll ask around. These are some more challengers in LD 16. We don't know where they stand. This is the other way we're going to win safe staffing across New Jersey, if not through this union contract. But back to that first chart, we're creating pressure in the community and amongst the rank and file at Robert Wood Johnson, and it's a who blinked first sort of situation. Is it going to be the state bill that passes first, or are these nurses going to win it in this contract? So let's ask them. Let's go to campaign events for the next week. I know election day is coming up. We can contact them through email, phone, and just ask them, do you support safe staffing that would require appropriate and enforceable nurse-to-patient ratios to keep nurses and patients safe? Now, a lot of these electeds take a lot of money from these legislators, so I think just having a really simple ask, do you support this bill? Will you co-sponsor this bill? Is the clearest way of getting an answer. And then just email us once you get that answer. Another thing you can do, actually, I'll pass it over to Jess because she was actually pretty instrumental in getting this, but there's something else we can do as well in our towns. So take it away, Jess.
As Isaac was saying, there is another thing that we can do in our municipalities is we can pass a resolution in support of the safe staffing bill. So we actually have passed a resolution in support of the nurses in 2 or 3 different towns. I know we have one in Highland Park where I'm from. We've passed a resolution. I know that Maplewood has passed a resolution. And also maybe Edison, I haven't seen the resolution, but I had heard that they had. But those were in support of the striking nurses, which of course we want to support them. But we also need to go back and we need to ask for a municipal resolution that uses the language of the bill. Now, these resolutions are non-binding. It's not like they're, because they signed it, then the state legislators are going to support it, but it's a really wonderful grassroots way of putting pressure from the base and up. So if you pass a resolution in your municipality, then part of that resolution actually says that it will be, in the draft that we have, in the model that we have, says that it will be sent to the governor, says that it will be sent to the representatives in your area. So what I've done in the past with these types of resolutions is then reached out to my state legislators and say, look, I live in Highland Park. We've passed, my municipality has passed this resolution. I need you to co-sponsor this bill, or I need you to support this bill. So it's a really wonderful, it is also an excellent way to get the community engaged, because you are bringing attention to your friends, to your neighbors about this issue. Then you can say, look, we passed this municipal resolution. Now we all need to call our legislators and say, you know, you need to co-sponsor, you need to support. And I just want to say, this should be a bipartisan issue, right? We are all going to the hospital. I mean, nobody, it doesn't matter your political affiliation, whether you go to the hospital or not, right? So this should not be a partisan issue. We should be approaching all of our legislators and all of our municipalities and saying, have you ever been to a hospital? Do you know anyone who's been to a hospital? Then this matters to you. So these municipal resolutions, I'd be happy to talk to anybody afterwards. I think there are others here I know who would be willing to talk, but they're really an important part of a grassroots strategy to get people on board in our communities, but also to get our legislators on board. And again, they're another way to organize. What we've done in the past, we email and we say we'd like this to be put on the agenda. Then we watch to see if it's put on the agenda. If it's not put on the agenda, then we make a lot of people email the mayor and council and say, get it on the agenda. And then we organize community members and invite nurses to speak about the importance of it at that council meeting when they're voting. It's a really important way to build community support. We're moving into the place where we're going to get to hear from you and answer questions and hear any kind of comments that you have in response to this. But we just want to let you know, if you signed in today, we will make sure to keep you updated about any kind of actions that we have and ways that you can support. Of course, with anything, you're always able to say, I don't want to be on this listserv anymore. We'd love for you to be on it, but you always have that opportunity. But we'd love for you, if you didn't sign in, to make sure you sign in. And then a couple of upcoming events, and then we'll open the mic for questions or comments. But there is, someone mentioned, I think Carol mentioned, and a couple of nurses have mentioned that there is a field hearing with Bernie Sanders on October 27th. So I think that's just this coming week, right? I've lost track of the dates. Friday, okay. So Friday, the address is there. It is a first come, first serve. Make sure you, is that the right? Yeah, first come, first serve, that's right. And make sure you come so that you have a seat. It will be live streamed as well, but it's always nice to be in person with others, I think, unless you want to see it live streamed, and there's definitely reasons that you would want to do that too. So, the last thing before we go on to the Q&A, just 1 second, is we do our next town hall we're hoping to have in Essex County. Like we said, we're trying to have town halls. Our goal is to have them in everywhere we know RWJ Barnabas has a network hospital. And so our next one, we don't have all the details planned, will be in Essex County. So let's go to Q&A. We know you've been sitting and hearing from us. We want to make sure that we get your responses. So this is an invitation to respond to the information presented or ask questions of our speakers. So if our speakers can come up and sit up here, that would be terrific. We also want to acknowledge that we have a lot of other nurses here as well, and members of the steering committee of this coalition. And we just ask you kindly to adhere to the following guidelines. So limit your comments or questions to 2 minutes. I can be wordy myself, so just think about 2 minutes and what that might be. And then also, prior to asking another question or comment, let's make sure that everybody has an opportunity to ask or respond first. And Julie, are you going to run the mic? Okay, so if we have any questions or comments, feel free to raise your hand, no pressure, but we'd love to hear from you. And okay, great, we have one over here.